What about others? I would like to be sure that everybody can hear me. If you can hear me, just raise a sticker or just identify somehow so we can get started, please. Let me confirm. Okay, very well. I already introduced myself. I'm Iwa Johnson. This training, it's about healthcare leadership and quality improvement. In this particular training, we offer a distinctive educational opportunity for healthcare professionals throughout Africa. The fellowship is designed to enhance your understanding of critical areas such as patient safety, healthcare quality, and digital transformation in healthcare. Our programs align with the World Health Organization's Global Patient Safety Action Plan, ensuring that the objectives are recognized and impactful in every areas that we work in. So it's very straightforward. The objective is one, to champion transformational leadership models in our trainings, at our workplace. So we aim to advance healthcare quality and patient safety by promoting innovative leadership models. Number two is embracing digital transformation, which is very important today. So we want to emphasize that scalable digital intervention is important to improve healthcare delivery. Also, we have value-based healthcare system. Our programs develop strategies focused on value-based care to enhance process efficiency, performance monitoring, evaluation, and continuous learning. This is very crucial for building capacity of healthcare teams to deliver better outcomes. Also, we engage in comprehensive and patient safety sciences, including risk management, safety assessment, and establishing learning organizations. This is key to promoting patient safety. So we're going to get started very quickly. I would like to introduce Dr. Olusegun. I don't know if you can hear me. Can you hear me, Doctor?
Yes,
Dr.
I can.
Can you hear me? All
yes,
right. So all right, sir. I'll let you take the lead now as we get started. Thank you, sir.
Yeah, thank you very much for that introduction. Good morning, good afternoon, good evening, depending on where you are joining for this webinar this evening. Let me share my screen quickly. Can everybody see my screen?
Yes, we can.
Yes, I can.
Okay, thank you very much. So this evening we'll be talking about quality improvement. The speaker that introduced the webinar has spoken so much about what the program is all about, and one of it is actually to improve the quality of health services in our facilities. And I'm going to be quick about it. We might not finish, but wherever we reach today. So I'll be starting my discussion based on some data. This is from WHO and a bit dated. It was from WHO African Region 2020 reports and spoke about it, output data in Africa. You can see the first map speaking about quality of care index. Quality of care index is about how our services in Africa meet the expectation of the patients. And we can all see where our country belongs to. I can see my country there in red, and you know what red means. So you can also figure out where your country falls. And our quality of health index in WHO African region is about 62.3% of its potential. When we are talking about the potential, that means there are room for improvements, but we are just 62.3% of what we can achieve in that area. And this value is not the same for every African country. You can see countries that are topping, that are having 80% and above, and some other countries are far below that. So the second map is actually talking about the health system resilience. By health system resilience, we are talking about how prepared we are for the next pandemic or the next disaster, maybe not a pandemic. This is a function of the resources we have, the manpower we have, and some other key factors. You can also see where your country falls. Uh, I was in a presentation recently, and it was organized by the Federal Ministry of Health of my country, Nigeria. And the speaker from the Ministry of Health said one of those things that they can't understand about the health system in Nigeria is that they don't understand how we survived COVID. So speaking to the resilience of our system, before the pandemic became widespread, a lot of people postulated that dead bodies will be lying on the floor, especially on the streets in Africa, because of how the pandemic dealt with countries that are far more prepared than African countries. But it wasn't like that at the end of the day. And people are still pondering that how did we survive it, despite our poor health system. Let's move on. So I was a bit worried and bothered. If you look at the previous slide, my country is in red. So I was like, is this still that bad? That was 2020. That was the data that I could lay my hands on that actually aggregated all African countries. So just some few minutes ago, maybe about 5 minutes ago, I developed this slide and I realized that things has changed a bit. In 2020, Nigeria is in red. When we are talking about quality of care index, that means the expectation of our health system or our health facilities are not meeting the expectation of our patients. And, we are at the rock bottom. But, things has improved. See Nigeria today. Sorry, I might not be pointing at your country. So we can see Algeria, we can see Egypt, 47.5. We can see Kenya, 61.1. We can see South Africa, 64. So while talking about health outcomes and impacts, you can see the data in Africa. Again, look at where your country falls. You can see the percentage of women who received postnatal care within 2 days of childbirth. We know it's an important care for women that just delivered, so that we can be sure of their mental health. We can be sure of them coping well with their new status, among other things. And the bar charts reflect percentage of health facilities that are offering antenatal care services in Africa. Now you can see where your country falls to. Well, we can see Liberia topping the charts, and you can see the countries that are performing far lower. Then the third map is also showing something significant about the infant mortality rate per 1,000 live births. Also look at for your country and see where it falls. So all these, they are speaking to our health system that there are room for improvement. Let us see how we compare to the rest of the world. When we are talking about the percentage of global under 5 deaths, see Africa, see the Europeans. There's no room for comparison, right? So look at the under 5 mortality rates. Okay, the first is the under 5 mortality rates. You can see the bar for Africa. We can see that for the Europeans. And the second is the percentage of global under 5 deaths. The deaths in Africa is almost 50% of the total deaths when we compare to other regions. It's no longer news. It's a recent research revealed that people actually die from poor quality of care than poor access to care, because the percentage of people that lacks access is below those that are dying from poor quality of care. So that means in the process of trying to help our patients, we actually kill them at times. That's what it means. And 15% of these deaths in this country, or 15% of all deaths in this country, is attributed to poor quality of care. That is sad. And with that, we lose productivity due to poor quality of care, low medium income, low and medium income country. And to the tune of about 1.4 to 1.6 trillion per year. So what is quality improvement? Before I delve to what quality improvement is, I want you to understand that quality is doing the right thing first and doing it better the next time. So quality is not about you doing the wrong thing. It's not about you getting it wrong. It's about you getting it right, even at the first time, but at the next time you still do it better. So when we are talking about quality improvements, we are talking about improvement in patient safety, effectiveness, among other things, and the overall care experience. And this is actually a systemic approach. It's not about addressing just a part of our care delivery, but an holistic approach. It requires using specific methods and tools. Key point that we need to understand is that the health system is actually a complex environment. And we have to consider the intricate context when we are talking about quality improvements. And as I said, it requires a systemic approach. You can't improve without going the systemic way. And this actually involves identifying what the problem is, testing some solutions, and implementing changes. And you need real-time measurements. People are beginning to say data is the new gold. Some are saying it's the new oil. If your system is not driven by data, then you are missing out on some chances at improvement. So let us talk about health system approach to quality improvements. These will be some integrated strategies to enhance overall performance and outcome of healthcare system. And you should understand that it involves improving interconnected components of the health system, and is not about addressing an isolated issue. So when we are talking about health system improvement, we are not talking about you just having equipment in your facilities. We are not talking about you having just the right manpower. If you are fixing issues in isolation, you will realize that you are still not getting the required results and your investment is going down the drain. So it requires a systemic approach. And this involves collaboration, it involves coordination of all the essential elements which I have listed: the governance and leadership, the health workforce, the health information system, the delivery service, financing, access to essential medicines and technologies, community engagement, quality improvement processes. All these processes have to be coordinated and they have to be well coordinated. It's not just about coordination, but the stakeholders have to collaborate, because when the systems are not talking to each other or they are not talking to one another, we also miss out on some improvement opportunities. And, collaboration has to do with aligning the stakeholder around a shared objective. We must have our aim, and everybody must run with the aim, with the objective. So there's organizational flexibility to quality improvements. There is no one method fit it all. So, but for you to improve your system, you actually need to put structures in place. And when we are talking about the structure does not necessarily need to be the same way with what is obtainable in some other facility, but structure has to be in place. So that means you need to tailor your quality improvement structure to your institution. If a facility is just starting up, you can't compare the kind of quality improvement structure that they are going to have with what you find in the teaching hospital or the general hospital, the bigger hospital. So you also need to actually clarify roles. People must know their roles, they must know their responsibility. And you should understand that this structure will also evolve. The kind of structure that you're going to start with is not going to be the same structure that you will still be using to drive improvement when your facility is now attending to over 10,000 patients. The structure has to evolve at every stage. And, this structure will be influenced by several other factors. And you have to define processes if you really want to improve. And we have different implementation levels to improvement. Some take it at the national level, some take it at the state level, and of course, we also have facility level. But aims and objectives at all different levels must align. So let us talk about quality improvement methodologies. There are quite a number of them, but I've just listed a few here. We have the PDSA, which is the Plan, Do, Study, Act. That means you develop a plan. The doing part is implementing your plan. While you are implementing the plan, you are gathering data. So when you analyze your data, you get some insights. That's where the study part comes in. With what the insight you've gotten from your data, it will help you to act. The plan you've developed, which you have implemented, do you want to modify it? Do you want to scale it up? Maybe you start an improvement strategy from the laboratory. After the expiration of the project, maybe after 3 months or after 6 months, we want to look at the data. Has that improved your services in the laboratory? If it has, the data is going to tell you. And from there, you can now begin to plan. Should you scale it up? Should you include the pharmacy now? Should you include some other part of your facility? So that is what PDSA is all about. We have the Six Sigma, which try to reduce wastes, and it has its own method and approach too. We have the lean healthcare, the total quality management, the theory of constraint, casing in healthcare. I think there should be a day for just discussing quality improvement methodologies, because that's actually the meat of discussion when we are talking about quality improvement. We also have some toolkits that you can use in improving. And the key components of the toolkits are data collection and analysis. Another is process improvement frameworks. Another is project management tools. Of course, communication and collaboration is another toolkit that is essential for improvement. A system that is not talking to one another, there will be difficulty. It will be difficult to improve. Training and education, technology and digital tools. Everybody is adopting technology now. Digital innovation is the new thing. Everybody wants to, adopt digital tools so that they can reduce wastes and, they can quickly improve in their system. So I'm going to the first one. I'm going to take the two kits one after the other. So we are starting with the data collection and analysis. When we are talking about data collection and analysis, we are talking about you running surveys, maybe twice a year. It can be a customer satisfaction survey that you send to all your patients to get feedbacks on what you should improve on, to get feedbacks on how you are faring. You should not be the judge of your own. Sometimes you want to even send survey to the staff to get feedback from them. The kind of training that they feel can improve their skills. Maybe in-house training or trainings that you can send them for outside. How they think they can be better, how they think you as the director or as the CEO of your facility, you can improve your service delivery. So you want to run such surveys and get some feedbacks, gather data, analyze it, and get some insights so that you can begin to make data-driven decisions. So that's will involve you doing some charts and graphs, some visuals to present to your patients, to your staff, the report of the feedback you've gotten from them. And of course, root cause analysis is another big one. We can spend a day discussing root cause analysis. Some problems that we address in our facilities, we are not addressing the root causes. We are just addressing the surface. We are not having hospital patronage. We want to ask why. From getting the reason why you are not having the enough patronage, okay, our services are not good enough. You want to ask another why. Why is the service not good enough? Okay, maybe the ambience is poor, maybe the staff are hostile, maybe the equipment you are using are not good enough, or maybe the outcome of your care is bad. You give them anti-malaria and they keep coming 2, 3, 4, 5 times. Maybe, you want to keep asking why. In fact, one of the quality improvement methodology is the 5 whys. That means you keep asking why until you get to the bottom. What is actually the root cause of the problem? So I spoke about the process improvement framework. I have listed them, the PDSA cycle, where you test and you implement changes. I spoke about you developing a plan for improvements, how you do by implementing your plan, how you study with data, analyze the data to get insights so that you can be able to act. So it helps you test and implement changes in a systematic way. We spoke about the Lean methodology, which help in reducing waste and improving efficiency. The Six Sigma and the total quality management. And these are the framework. So another tool is the project management tools. We have the Gantt charts that can help you visualize your project timelines and tracking progress. You don't just leave things, a project to run indefinitely. You want to have timeline. You want to have SWOT analysis. You want to know the strength of your system, the weakness, opportunities and threats. They will help you plan better. They will help you improve your system. Then you want to set SMART goals. By SMART goals, we are talking about specific, measurable, achievable, attainable, you know, timeline, with timeline. So we are talking about setting SMART goals. You don't just, instruct someone to go and do something definitely, and they keep postponing you. You set timeline. You want to achieve this. You want to be this good by this. In the next 6 months, you want to improve our service delivery by this. That's that is setting SMART goals. Like, for example, you want to cut down hospital acquired infection in our facility by 50% in the next 6 months. That is specific, is measurable, because 50% is the target. Of course, it's achievable, and we've set a timeline. You want to, you can just begin to mention them or name them. Setting SMART goal is really important if you want to improve. Communication and collaboration. You need to constantly meet with your teams. You need to discuss with them regularly. You don't just be the alpha and omega, be the only decision maker. Strategize, implement, and do everything. You need to actually work in teams. And you need to constantly get feedbacks, review progress, and you need to be planning actions, what to do next. All your meetings, you must have action plans, and you must have next steps. You have to engage your stakeholders, and you should understand that patients are important part of your stakeholders. Your community where you operate, they are important part of your stakeholders. Then you need a feedback loop. You need to constantly get feedback from your patients. Not only your patients, you need feedback from your team too, your staff. What they will know at their level, you can't know at your own level. Training and education, this is very significant. If you are not training your staff, you shouldn't expect much from them. And you need to know that a staff you don't invest in shouldn't expect much from them. You need to constantly have training. You need to develop people to be good enough to leave. But you need to treat them fair enough that they will want to stay. So you have to send them to workshops, to seminars, online courses, best practices. For me, I sometimes advise people that your staff mandate them that they must do an online course every year. Go to Coursera, go online, see courses that will improve their service delivery, that will make them better, or probably in areas where they are struggling. Instead of you punishing them or removing their salary, set them up to do a course, give them a timeline. That's okay. I realize that you are not addressing the patient well. You have to do this course. I've seen it on Coursera. You apply for it from your salary and you run it. You have to finish it by so timeline. I want to see the certificates. When the person is done, tell the person to come and step it down to the rest of your staff. Those are ways that you can improve your service delivery. It's not just about improving yourself. You can't do everything. So you need to give them the opportunity to go for workshop, for seminars. Give them opportunity to do online courses. Give them the opportunity to embrace best practices. Technology and digital tools. Electronic health records, I've worked in hospital where sometimes patients will come and we sometimes have to open a new file for them because we couldn't find their old file. A better way is to run an electronic health record. That you can always find their information the easiest way. It will also even reduce the waiting time at the desk where they have to retrieve their file. We have to embrace clinical decision support system. This will provide evidence-based guidance to clinicians. It is only in Africa that we believe we know everything offhand. You need SOPs. You need to be guided by informations. Then we need a quality dashboard that will display key performance indicators and their metrics. I went for an assessment recently and I was telling the owner of the facility that there are KPIs that you need to be demanding from your staff every month. Those that are in record, you want to know the number of patients you attend to every month. They should submit. At the beginning of a new month, it should be on your table. You want to know the number of female patients, the number of male patients. You want to know the distribution per diagnosis. You want to know the diseases that your patient presents with most. You want to know the drugs that you should stock the most. You want to know the areas that you need to improve on, the kind of training that you feel that will benefit your staff the most based on data that you are receiving from them. So I'm going to facility level activities for quality improvements. As I mentioned earlier, I said improvement can be at the national and the state level. And of course, it can also be at the facility level. And when we are talking about facility level activities for improvement, there are startup activities and there are ongoing activities. When we see we can see the list of the startup activities. We have to be able to identify clear facility aim. When you don't have an aim, everybody will just be doing whatever pleases them. You need to have aim for your improvement activities. You need to establish a quality improvement team. That is the place to start. And you need to identify gaps. Don't just identify gaps by, a random thoughts. You have to actually assess your processes end to end and see where the gaps are. You need to adopt standard of care and you need to develop action plans. By action plans, I mean quality improvement plans, area you need to improve from. You need to also implement your action plan. It is very important to implement your action plan. So let us look at the startup activity more closely. When we are saying that you should identify clear facility, we are saying that you should define clear statement of purpose. You should identify approaches, tools, and resources that can help you improve. And should create a quality management structure. By structure, we are saying you should have a quality management team that will have a lead. And they should meet as frequently as you feel is good enough for your environment. Maybe monthly, maybe quarterly, maybe every 2 weeks. Then you should incentivize quality through recognition and training. People that are doing well, recognize them. And one way to actually reward them is by sending them for training. So another startup activity is establishing quality improvement teams, which I think I've spoken about. A team must be with a leader. A team without leader will not work. And you need to include people with interest, people that you know they are interested in improvements, people with knowledge or they are willing to at least learn, people that can address administrative and management issues. You have to include a representative from the community or patient group. As I said the other time, I said they are important stakeholders. Things that you won't see as the provider that you feel you are doing well. Patients will see. You need to develop terms of reference for the team, and you need to introduce the team to staff, to the community and other stakeholders, so that when they approach them, they can give them maximum cooperation and they can know that they are acting in the best interest of the organization. As I said earlier, you also need to identify gaps. You want to do a situational analysis or an assessment, a facility assessment. There are quite a number of tools that you can use online, even WHO tool, to, to check for the gaps in your service delivery, in your facility. You need to adopt standard of care, as you said earlier. You need to set goal for improving performance. Without goal, people will just be doing whatever they like. You need to develop action plans. You define clear targets with a time frame. You want to be this good by this time. You want to develop an action plan that lists all the actions to be taken to implement the interventions that will improve your facility. Then you want to implement this action. You want to pilot it on a small scale first. You don't just start a facility-wide improvement activity. You start at a small scale, you review to see if it is working before you scale it up. Sometimes when it is not working, you have to tweak, you have to refine before you scale it up. Then you want to execute with periodic measurement and leadership support for institutionalization. Because if you don't institutionalize your improvement processes, it will die out with time. And you want to consider the best way to share the good practices. It can be during meetings, it can be an exchange visit, it can be in an online webinar like this. Someday you can be invited to share your improvement activities and where you are winning so that others can learn from. And it can be through other virtual platform or in-person platform. Ongoing activities. Yeah. You have to continue to measure. You can't run a system without measuring. You have to constantly collect and utilize measurement data to assess intervention effectiveness. You want to see how well you are doing. You want to share your learning through discussions, through peer-to-peer learning, through exchange visits. Sometimes you want to have stand-ups with your staff, maybe early in the morning. Some facility we call it morning review, some facility we call it all sorts of names. But early in the morning, you want to meet with all your staff and set a clear aim and objective for the day. What each and everyone should do and they should achieve before the end of the day. So you also want to sustain improvements by institutionalizing the improvement gains. You want to revise those procedures. Whatever you need to adapt, whatever you need to adopt, and whatever you need to scale up. You want to recognize achievements through awards and acknowledging successes. I think I've spoken about that. When someone is doing well, you want to recognize the person and appreciate the person before the whole team. That is going to encourage others. So when we are talking about reward system, it's not about giving money all the time. It's part of it. It's not about promotion all the time. It's a good part of it. But sometimes recognition goes a long way. Then you want to refine your action plans. You want to foster supportive environment for continuous improvement. And in creating such environments, that means you are not looking for scapegoats to punish. You want them to be able to come to you when they made a mistake, so that you can sit down and plan that this is an opportunity to improve. How do we prevent this from happening the next time? You want to develop health workforce with career path and professional development. As I said earlier, train them enough that they be good enough to live. Then you want to ensure continuous support for quality improvement efforts. And by continuous support, we are talking about coaching, we are talking about mentorship, and addressing emerging challenges promptly. to maintain progress. So if you can see this, these are drivers, enablers of quality improvements. Leadership is key. The first line, they are the primary drivers. Leadership, employee engagement. If you don't get them to engage, I'm sorry, you might not be able to improve. Technology and tools, they are important. Data and analytics is very important. Your decision has to be backed up by data. Organizational structure and processes, this will include SOPs, establishing SOPs, communications and collaboration. For each of the primary drivers, I've listed 2 secondary drivers, which you can see. For the first, you can see strong support and active involvement from top management and leadership fostering a culture of continuous improvement. I want you to understand that improvement is a top-down approach. If you as a leader, you are giving the vibe that improvement is not important, don't expect the staff to take improvement serious. But when they realize that you are taking the lead, of course, they will all fall in line. When we are talking about employee engagement, we are talking about involvement and participation of employees in quality initiatives, training and developing programs to equip employees with necessary skills. For technology and tools, you just need to adopt technology and tools. In fact, there's an open source for some quality assessment tool that you can find online to assess the quality of your service. Data and analytics, I think I've flogged that enough. Organizational structure and processes. You have to establish dedicated quality improvement teams or departments. And you need to clearly have SOPs. You need written SOPs. You need processes, you need protocols for implementing quality initiatives. Communication and collaboration, this is what brings everything together. You need to effectively communicate channels for sharing knowledge and best practices. You need collaboration between your teams, between the departments, and even with external partners. And for each of these secondary drivers, you can begin to test some quality improvement initiatives on them. So let's talk about leadership. Now, there is also no single best approach. There are different leadership roles, from managers to leaders to head of departments, the CEOs. There are different roles and they have their different responsibilities. And sometimes leaderships are designated, while sometimes they are informal. You just step up to the occasion. You realize that the person that's supposed to act as the leader is not acting as the leader. You just step up. But it is better to have a designated leaders. What do we mean? If you are setting up a team and you are appointing leaders and they're having roles and responsibilities, all these must reflect in their job description. Whatever is not reflecting their job description, you can't hold them accountable for it. And there are different leadership styles that you can adopt. Now, let us look at the importance of supportive leadership. Improvements are faster with supportive and acknowledgeable leaders. And leaders are also critical in owning and expanding quality improvement approach, especially when you're implementing and you're scaling up. They also set goals. They equip staff to reach those goals, maybe by sending them for training or by helping them when they realize they are struggling. And they build management structure. They also, they provide, they inform the kind of culture of innovation that your facility is going to adopt. If your staff are going to have problem-solving skills, it's largely dependent on the leaders. Critical roles and coordination. You need to understand that leadership is crucial for quality improvement. And you can't actually establish a functioning quality improvement or quality assurance without an effective leadership. In fact, no organization has ever risen beyond the capacity of their leader. And leaders are involved in resource allocation and in creating an enabling environment. Leaders will also help in actually coordinating all the roles so that they can get the best of results. Let us look at leadership responsibilities. They are involved in creating the vision and the core values, advocacy for quality, the model quality assurance principles. They are important in allocating resources for improvement, and they also empower staff. Some of these I have touched. Technology and tools. There are quite a number of technology tools that you can use for improvement. Some enhance patient care, like the electronic health record, the telemedicine, and the clinical decision support system. Another one is improving operational efficiency. This involves use of tools like health information exchange, robotics, and automation, which is not common around it in Africa. Another one is enhancing data management and security, which involves the use of artificial intelligence and machine learning in blockchain technology. And the fourth one is facilitating continuous monitoring and personalized care, which involves use of mobile health and the IoT, which we call Internet of Things. Then genomics and personalized medicine. Some of these tools we are not so familiar with. So when we are talking about data analytics and data for decision making, it has quite a number of advantages. And of course, we can use it the wrong way because, human being can be subjective at times. So advantages of data-driven decision making are they are usable information, they help in your strategies, they help in qualitative and quantitative data, they help in transparent system, and agility. Agility means your ability to actually improve in a fast way. What are the pitfalls? Data can be misinterpreted to suit what you have in mind. That means we can be subjective in our interpretation of data. And when we don't completely understand the data, it can also affect the decision we make. Let us talk about structures and processes. We've spoken a bit about it, but you need to understand why it is necessary. You need structure and processes so that you can optimize your resources. And you also need it for systematic goal alignment. And essential ingredient for institutionalization is clear rule delineation and effective mechanisms. If you don't have structures and processes in place, it will be difficult for you to have an effective system. We are talking about establishing mechanism for oversight, for decision making, for support system, for implementation and coordination. And implementation steps will include setting up a team, which is a quality improvement team, defining their roles. These roles are not just defined verbally, but they are documented in their job description. and you implement systems to streamline operations. Now, when we are talking about key aspects of structure, we'll be talking about oversight. Clear responsibility of quality assurance oversight is crucial, including leadership support and technical oversight. Coordination is a significant part too, because you will be working with different teams, with different training, with different background. If they are not well coordinated, you might not get the best of them. And some of them, they work in different settings, different circumstances, and different organizational levels. So integrating and making them work in the synergistic way and coordinated way is what is going to bring the best of results. Roles and responsibility has been spoken about, and how they have to be documented in their job description, and they must be accountable. That means there must be a reporting system. There must be a reporting system. This is flexible, and different structure is applicable to different level in different organizations. Communication, we've spoken about communication. Communication is a two-way interaction. When you are speaking to your staff, you need a feedback. You need to get something in return. And it is in communicating with your staff or your patient that you identify quality gaps that you need to work on. It will also reinforce core values, because when you share your value with your staff, they understand where you are going to, and they'll be able to help you better. It provides information for advocacy and for benchmarking and change management. And this has to be done in a formal way. That means you need a communication plan, standard or policy for your organization. You have to reinforce the way to communicate in your organization at all times, so that new staff that are joining you, they will understand how you communicate in your organization. There are organizations that you don't just go directly to the overall boss. You communicate your idea through the head of your department to your overall boss. Now, to have a successful communication, support for quality improvements, you need to actually record improvements. That means you need to document improvements. You need to share achievements. All these, they are big part of communication. And you need to use your results for advocacy. If you have set a goal and you achieve the goal, you need to share the results with your team. And you need to use it for advocacy, to drive new policies, to transform your learning environment. Communication is really significant in all these areas. Sorry, are we all still here?
Yes, we are, sir. Yeah.
So this is where I stop today. Do you have any question? Any addition? Any subtraction? Question, please.
I have a question.
Okay.
Can you hear me?
Yes, I can. Please go on.
Okay. All right. So for you made mention of personnel trainings, and in your experience, what are some strategies you use in engaging personnel who are resistant to participating in training programs, or they do not really have the probably self-esteem or capacity um, to be involved in this kind of things, because it produces efficiency when all of your personnel are active and they are learning part-time, which is very important. So what are some few strategies that uh, one can deploy to solving this particular problem? Thank you.
Okay, thank you very much for that question. Now, when we are talking about improvements or change management, leaders must always be involved. If me as your employer, I'm in a training session, I will expect all my employees to be in the same training session. That's number one. Another important strategy is giving them roles and responsibility in the training. It might not be a big one for start, and they can graduate with time. When you give them roles and responsibility, they tend to be more engaged and participate more. And when you are giving people roles and responsibility, if it is something that they need to turn in, you also set timeline. Another important approach is making these parts of your organizational core value. It becomes your culture. When it is your culture, nobody can step back. When I'm going to school, I know I'm going to school to learn. They cannot be having a class and I want to exempt myself that I'm not interested because I'm in the school, the first place, to learn. And I know that is what is going to happen. You are coming to this organization at the point of entry. It must be clear that your promotion in this organization is going to be dependent on improving. And our improvement process is largely based on training. So when all these are clearly spelled out, people tend to engage more. Yes, we are all not at the same level. You will realize that some are much more engaged than others. Sometimes, if you need to have a smaller group where you pair the weak with the strong ones, and where they can help each other, help one another, so that when you meet as a group, they are better informed. Questions that they might not be able to ask in a bigger meeting, they might be able to ask their partner. These are a few strategies that I think has worked. Sometimes having training can even be an online thing. It can be a WhatsApp thing where you drop something for the week for all of them to study. And at the end of the week, you have a discussion about what has been sent to the WhatsApp platform before you start your weekend. And you deliberate on it. Everybody contributes based on what they've gained, on what you have sent on the platform. So doing it that way, when I know that in such meeting, I'll be called upon to give my own 15 cents, I will want to have something intentionally written down. And recognizing people that are doing well, people that are contributing well, you also go a long way. And in such meeting, especially when we are talking about quality improvements, as much as possible, don't penalize people. Don't see any question or any idea as a terrible idea. You understand? that can go a long way to actually shut some people down. Even when people are trying to laugh at an idea, you have to caution them. These are approaches that I think has helped a long way in helping people improve. You know, when something is not tied to learning, to training, people will be like a lackadaisical. Recently, I was telling someone that if I have an organization and I know that people leave most private organizations, for example, because there is no career path, there is no opportunity to grow. I will make them understand that before you can, you won't be promoted based on the number of years that you have shared, that you have spent with the organization, but based on the number of new courses that you have done, and you can impact on other staff, and you can also impact on the way you work in your organization. When people see such initiative, of course, nobody wants to stay on the same spot. They will sit up and take up opportunities to progress. Thank you. I don't know if I answered your question.
I got something from that. Thank you, sir. All right, do we have any body with questions? All right, I don't think so. I would like to recognize Dr. Shola Oneyide. I don't know if you can speak. Oh, I don't think, okay, he's here.
All right, thank you, Dr. Paul, for that your wonderful presentation. I'm expecting us to give some comment and feedback. However, I want to let us know that this session is recorded and it will be on the YouTube channel of the institute. We may take time to watch it again and prepare our question against our next webinar. However, this series are still introductory series. We are still going into details and we are going to still give tools that we can use to adapt for our own tools that we can adapt for our own organization. And we want to encourage us that we should start thinking about projects that we want to embark on that has to do with quality improvement. If we are following the conversation, it will be important that we also ask questions. I always believe that the evidence that we fully follow a conversation is the fact that we have comments and we have questions. Thank you very much.
All right, sir. Thank you very much. Please, that means we can end the meeting now. If you have any more questions or suggestions, please just reach out to the WhatsApp group. Thank you very much. It's so nice to be with everyone here. Thank you. We can leave now. Bye-bye.
Bye.
Bye, thanks.